6.1. Make word combination using a word from each box. Look at A, B, and C opposite to help. The words are associate, house, own, provisional, radio, word, call, diagnosis, officer, pager, round, specialist. The combinations are house officer, associate specialist, ward round, on call, and radio pager. 6.2. Match the description 1 to 5 with the job titles A to E. Look at A and B opposite to help you. Dr. Graham has been a pediatrician for 8 years and is responsible for training the children admitted to Ward 60. Dr. Stewart has just started the second year of her foundation program. She is a SHO and Dr. Graham is a consultant. Dr. Singh has started his training as a he is Philip graduate and is working in a large rehab. He is a PRHO or house officer. Dr. Miller is in charge of the medical staff in the Birmingham Hospital. He is a medical director. 6.3. Are the following statements true or false? False. False. Find reason for your B and C opposite. 1. Register graduation? That's false. The system of training doctors in breeding is called the Foundation Program. False. The name senior house officer is no longer used in breeding. The consultant is usually the first doctor to see new patients. False. When working in shift, all doctors take turns to be on call. True. Complete the text of a PRHO describing her job. Look A, B, and C opposite to help you. When I get to the ward, the first thing I do is talk to the house officer who was on duty during the last shift to find out if there have been any new admissions. Then I generally see the charge nurse. He tells me if there is anything that needs to be done urgently, such as intravenous lines to put up or take down later in the morning, check any new patients, which basically involves taking a history. On Tuesday and Friday morning, the consultant does the her ward round, and I have to make sure I'm completely up to date on her patients. After that, there are usually lots of things to do, like reading up request forms for blood tests, and so on. In the afternoon, I have to prepare for any patient who are to be discards. The next day, they're usually happy to be going home. And then, of course, there are the lectures and tutorials in the foundation program of Monday and Wednesday. Seven, nurses. Nursing grades. Nurses working in the following grades: a student nurse, a nurse who is still in training, a staff nurse, a nurse who has completed the training course, charge nurse, a more experienced nurse who is in charge of or responsible for a ward of the or department, nurse manager, a nurse who is in charge of several wards. Note, the old term sister is still something used for a female charge nurse. A female nurse manager may be called matron. Dr. James is talking to Sister Watkins. Número 7, enfermeras. Los grados de enfermería. Las enfermeras que trabajan en un hospital tienen los siguientes grados. Estudiante de enfermería, una enfermera que todavía está en el entrenamiento, una enfermera de servicio o una enfermera o una enfermera que ha completado su curso de entrenamiento. Enfermera en cargo es una más experimentada enfermera que está a cargo o es responsable por un pabellón. Y o la enfermera supervisora está a cargo de varios pabellones. antiguo, hermana, es también utilizado para una enfermera cargo mujer. Una enfermera mujer supervisora, también llamada matrón. Por ejemplo, el doctor James está hablando con la hermana Watts o la enfermera Watts. B. Support workers. The clinical support worker who short course and obtain basic qualification. The nursing auxiliary who is usually unqualified but assist nursing staff. There may also be ward clerks whose duties include making sure patient notes and information are up to date and answering the telephone. Trabajadores de soporte, los trabajadores de clínico de soporte hicieron un curso básico y obtuvieron las calificaciones básicas para ser auxiliares de enfermería. Eh, Aunque están usualmente incalificados, al, al, ambos asisten al personal, ambos asisten al personal de enfermería. Y algunos son guardianes de pabellón. Esto quiere decir que están a cargo de asegurarse de los pacientes, tomar notas de ellos y sacar información con su fecha y responder el teléfono. Sí, specialization. Like doctors, nurse can specialize. A midwife has specialized by doing a course in midwifery, the management of birth. Especialización. Igual que los doctores, las enfermeras también pueden especializarse. Una midwife o una media esposa puede especializarse eh, desde el principio, haciendo un curso de esto para poder manejar embarazos y nacimientos de niños. District nurse visit patients in their homes. Una enfermera de distrito visita a los pacientes en su casa. Health visitors also work in the community giving advice on the promotion of health and the prevention of illness. Los visitadores médicos también también trabajan en la comunidad dando promoción de salud y para la prevención de enfermedades. D. The nurse role. The nurse role has changed considerably in recent years. In addition to general patients care, checking temperatures, pulse rates, and blood pressure, changing dressing, giving injection, and removing sutures. Nurse how do some of the things previously reserved for doctors, such as prescribing drugs and ordering laboratory tests. More responsibility for nurses planet, as the following article demonstrates. Nurse carry out surgery in a fort to cut patient waiting list. Nurse in Scotland training to perform minor surgery have entered the operating theatre for the first time in an effort to cut patients waiting time. 5 nurses who have passed a new course at Glasgow Caledonian University are now qualified to carry out such procedures as the removal of small lesions, being most and cysts. The verbs performed and carry out are used with all types of procedures. They are often used in the passive form. Perform, carry out, an examination, an operation, a procedure, experiment, a test, a biopsy. The procedure was performed or carried out by a nurse. El rol de la enfermera. El rol de la enfermera ha cambiado considerablemente en los recientes años. En adición, eh, en general, desde cuidar al paciente, checar temperatura, checar pulso, la presión sanguínea, cambiarle la vestimenta, inyectarlo, remover suturas. Las enfermeras ahora hacen cosas que previamente solo estaban reservadas para doctores, como prescribir medicamentos y tener examen de laboratorio. Hay más responsabilidad para las enfermeras de lo que muestra ese artículo. Enfermera lleva a cabo una cirugía eh, para curar a un paciente en la lista de espera. Los verbos, los verbos realizar y llevar a cabo se utilizan en todos los tipos de procedimientos y a menudo en la forma llevar a cabo un examen, una operación, un procedimiento, un experimento, un examen, una biopsia, y el procedimiento fue llevado a cabo o fue realizado por una enfermera. Y escúchame. 7.1. Complete the sentence. Look at A, B, and C opposite to help you. Someone who specializes in delivering babies is a midwife. Someone who is qualified to assist nurse in a clinic is a clinical support worker. Someone who is not qualified but is able to assist nurse is a nursing auxiliary. A nurse who has qualified is a staff nurse. A nurse who specializes in health promotion is a health visitor. A nurse who looks after a ward is a charge nurse. A nurse who works in the community is a district nurse. Someone who answers the ward telephone is a ward clerk. 7.2. Make word combination using a word or phrase for in each box. Look at the opposite to help you. Carry out, change, check, give, remove, sutures, a procedure, an injection, addressing the temperature. Check the temperature, change addressing, give an injection, remove sutures, carry out a procedure. 7.3, complete the sentence with the correct grammatical form to perform. An insoluble brain scan is painless and easy to perform. Biopsy of the pancreas was performed last March. If the patient's condition deteriorates, a laparotomy should be performed. If a diagnosis of meningitis is suspected, a lumbar puncture must be performed. Last year, we performed a randomized double-blind group study. 7.4, complete the sentence with the correct grammatical form of carry out. I now intend to carry out a large study. Unfortunately, few properly controlled trials have been carried out so far. A number of studies have been carried out recently to look at this question. A right hemicolectomy was carried out and the patient made a full recovery. This procedure can be carried out in the emergency department. Allied health professionals. Community health. The health of the community depends on a large number of people other than medical practitioners and nurses. This can be grouped under the heading of allied health professionals. They include the following. Physiotherapists or physios help people to move by getting them to do exercise or by treating their body with heat or massage treatment by manipulation muscles and joints with the hands. See Unit 42. Occupational therapists, OTS, help people with a disability to perform tasks at home and at work. A disability is a physical or mental condition that makes it difficult to live normally. For example, blindness or deafness. Social workers help people to solve their social problems. For example, poor housing or unemployment or family problems. Chiropodists, also known as podiatrists, treat conditions affecting the feet. Aliados profesionales de la salud. Eh, la salud comunitaria. La salud de la comunidad depende en gran medida del número de personas, es decir, de los médicos, de los practicantes médicos y enfermeras. También puede haber grupos bajo el liderazgo de los aliados de la salud profesionales, que incluyen los fisioterapeutas que ayudan a las personas haciendo ejercicios o tratando su cuerpo con masajes o calor, manipulando los músculos y con sus manos. Los terapeutas ocupacionales ayudan a la persona con discapacidades a, a realizar actos de la casa en el trabajo. Una discapacidad es una condición físico-mental que hace muy difícil el vivir normalmente. Por ejemplo, la ceguera o o ser sordo. Los trabajadores sociales son que son gente que ayudan a la persona con sus problemas sociales, por ejemplo, pobreza o desempleo, problemas familiares. Los quiropodistas, también llamamos podi, ¿cómo es? Podólogo, podiatra, tratan condiciones que afectan el pie. B, technicians. There are numerous technicians, people who work with scientific equipment such as radiographers who are known as X-ray technicians, ambulance technician work in the emergency medicine service, an ambulance technician with more advanced qualifications is called a paramedic. Técnicos. Hay numerosos tipos de técnicos, son personas que estudian con equipo científico, como los radiógrafos, que son conocidos como los técnicos en rayo X, o los técnicos de ambulancia que trabajan en el servicio de emergencia, y un técnico de ambulancia con mayor grado de, cali- de qualification, o sea, que está más calificado, se llama paramédico. Sí, prothetist and orthotist. Prothetist and orthotist provide care for anyone who needs an artificial limb, a prosthesis, or a device to support or control part of the body. And orthosis, they also advise of rehabilitation, helping patients return to normal life and work after treatment. Prothetists provide artificial replacements for patients who have had an amputation or were born without a limb. Orthotists provide a range of splints and other devices to aid movement, correct deformity from a normal de de development of part of the body. For example, club food and relief pain. Opticians. Optician test eyesight and prescribe glasses, also known as spectacles and contact lenses when necessary. The examination includes measuring intraocular pressure, the pressure of fluid inside the eye, and examining the retina. If the optician suspect an eye disease, such as a glaucoma, they refer the patient to their GP for treatment. The GP may then refer the patient to an ophthalmologist, a doctor who specializes in disease of the eye. H.1. Make word combination using a word from each box. Look at A, B, C, and D opposite to help you. Ambulance, artificial club, contact, health, intraocular, occupational, social, food, lens, limb, worker, pressure, technician, professional, or therapist. Ambulance technician, artificial limb, club food, contact lens, health professional, occupational therapist, social worker, intraocular pressure. 8.2, which allied health professional could best help the following people? Look A, B, C, and D opposite to help you. A young unmarried woman just who has just had a baby, social worker. A woman who is having difficulty using her right arm following a fracture, physiotherapist. Someone who needs glasses, optician. An elderly woman who has had a below knee amputation, occupational therapist. A man whose wife has Alzheimer's disease, social worker. A man with a fungal infection on his feet, podiatrist. Or H.3, complete the test, look at A and C opposite to help you. A prosthetist work with patients of all age as a member of a clinical team based at a large hospital. The patient may need prosthesis as the result of an accident or amputation. Following a disease such as diabetes, alternatively, they may have been born without limb. Orthotists work alongside doctors, nurses, physiotherapists, and occupational therapists to give people under their care the best possible rehabilitation. Their main aim is to enable the patient to lead a normal life at work and leisure. Our orthotist often works in a clinic as part of a patient service and also visits other centers to provide a service for people with special needs. They deal with people of all age. For instance, children who have cerebral palsy may require splints to help them walk, and many older people need special shoes to correct performance. If damaged, any part of the human skeleton may require some for or orthosis. The orthosis may be needed to reposition the body or to relieve pain. Hospitals. Introduction to a hospital. Jordi Pons is a fourth-year medical student from Barcelona. He has come to Britain on an elected attachment to the Royal Infirmary, Edinburgh, Dr. Barron. He's introducing him to the hospital, Dr. Barron. The Royal Infirmary is the name of the University Hospital of Edinburgh University. It is a general hospital dealing with all types of patient and illness, except pediatrics. We have a special hospital for that in another part of Edinburgh. The hospital for sick children, you can see some of the departments in our hospital on the sink. Of course, there are many others. For example, intensive care unit, ICU, and the surgical high dependency unit, HDU. Jordi, what does outpatient mean? Dr. Barham. Outpatients are the people who come to the hospital to attend a clinic or to have tests or treatment and then return home on the same day. Inpatients stay in the hospital for one or more days. The rooms where they stay are called wards. If a patient's treatment requires only one day, such as simple operation, they can be admitted to the day surgery unit. Welcome to the Royal Infirmary. South Entrance, car park, C&D, visitor and staff, the Simpson Center for Reproductive Health, gynecology, emergency, maternity emergency, neonatology emergency, all wards, day surgery unit, endoscopy, X-ray department, and combined assessment. Out, número 9, hospitales. Introducción